Hey, in this video, I'm going to give you my honest physical therapist review of Aspercreme spray with Lidocaine. My name is Dr. David Minoff, and I'm a specialist physical therapist here at El Paso Manual Physical Therapy, and we specialize in helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. We make tons of helpful videos with tips, advice, exercises, and stretches for many different conditions. You can go over to our playlist to check out one that might help you out. And please consider subscribing to our channel so that you don't miss out on any of the helpful videos we post every single week. So let's get into the review. We're going to talk about what lidocaine is first. Now, lidocaine is a medication. So this is an over-the-counter medication in a spray form, and it's a topical spray, meaning you can put it on your skin. Lidocaine itself is a synthetic chemical made in a lab, so it's not really a natural ingredient like some of the other pain relieving creams out there that involve menthol or oils of different kinds. This stuff's made in a lab through advanced chemistry techniques. Now, what's the research behind lidocaine? It's actually a highly effective pain reliever and used in many different settings, including dentistry. If you go to your general doctor, it's used to numb the skin typically, or the inside of your mouth if you're going over to the dentist. Now, you don't want to put this on the inside of your mouth. The directions tell you so right there. What we do know in the research is that it doesn't penetrate very deep. Because it's used on the skin, that's what we found it to be most effective, is that it only affects the skin. It numbs the nerve endings in your skin only, and it doesn't penetrate much deeper than that. There's good news and bad news for that. That means that you should technically get some pain relief by numbing your skin. But the bad news is if you have an injury that's deeper than just at the skin level, then it's probably not going to have a massive effect. Different people report different things, and I can tell you as a physical therapist, I have some patients that swear by this stuff when they're having a flare-up of some sort. They'll use Aspercreme with lidocaine in lieu of using like acetaminophen or ibuprofen, Tylenol, or Advil. But this is a medication, so you don't want to overdo it with this. Now, some things to watch out for when using Aspercreme with lidocaine is you don't want to spray this on an open wound. You want to make sure that the area that you're going to put it on is not cut in any way or irritated already. The skin itself should not look red and irritated. It's not to be used more than a week at a time because you can technically overdose on this stuff. It does penetrate your skin more. The more you put on, the more it should theoretically penetrate, and you can have some side effects from that. The most common side effect for Aspercreme with lidocaine is skin irritation. Now let's talk about how to use this stuff. It's really simple. Now it's got this child-proof top, so you've got to pinch the sides right here where there's little bumps, and then it's got directions on top on how to do it. Then you pinch it and turn it and pull at the same time, and it snaps off. And you have this spray top right there, so you just push the button and it sprays out. Let me show you, just like that. And just to tell you about the odor, it's got a little bit of an odor. It's not super strong like some of the other pain creams that you might use out there. And it's supposed to be quick drying, so we're gonna spray it on right now. And I don't have any pain, thankfully, so I can't tell you that it's effective on me, but like I said earlier, it's quite effective as shown by many research studies, and our patients use it all the time. So just a little spray like that is all you need. And I can see a little glistening on my arm. It's really not super wet, and it is drying pretty quickly right there. It's just taking seconds to evaporate. And this stuff is supposed to work pretty quick. Again, I don't have any pain, but maybe I'll get numb here by the time this video is over. Now, the directions say to spray the affected area every 6 to 8 hours and don't exceed using this more than 3 times in a 24-hour period. There's no need to rub it in, as I haven't rubbed it in, and I can already feel some different sensations in the area, like it's starting to go a little bit numb. And you know what it did? Yeah, I'd say the sensation is definitely different right there where I sprayed it versus over here where I didn't spray it. And there's no stickiness, there's no grimy feelings. If anything, it feels slightly moisturized. Nothing that feels odd. And I like this spray bottle because this is so strong and effective. You would rather not rub this on your hands like a lotion and then rub it in, because then you're gonna get it on your hands. You could be potentially putting more lidocaine into your body if you're having to rub it in with your hands. So I love the spray bottle for that reason. Now, to give you my honest opinion on whether or not you should use Aspercreme with lidocaine, I think that I would go towards a menthol-based product first, or an oil-based product first, something that's more naturally derived, not a medication made in the chemistry lab. But the other side of it is this is pretty effective. The other stuff might smell very strongly or may not be as effective for you. This is something though that I would keep in the medicine cabinet right next to the acetaminophen or ibuprofen, the Tylenol or the Advil, or the name brands for those medications. And this would be something to put on first if you're dealing with like back pain, neck pain, some sort of joint problem, and understand that it's not going to penetrate to the joint and fix chronic arthritis or some cartilage problem or some ligament or meniscus tear or some disc issue. The whole point is just to buy you some short-term pain relief so that you might get through some activity or get through a better night of rest without taking as strong as a medication as something you might take in your mouth. This could also buy you time from going to go visit the doctor for an injection or more severe stuff, but I would always encourage you to go fix the root of the problem, which is what we talk about heavily on this channel. Like I said at the beginning of the video, go check out our playlist and you can get advice, tips, exercises, stretches for treating the root of the problem. We also have programs that you can purchase where we go more in depth into treating root problems of chronic issues like back pain and knee pain. But in the short term, if you're looking for some relief, excellent choice, a little stronger than some of the other stuff out there, and just be careful with not overdoing this. Hey, if you thought this video was helpful for you, please give us a thumbs up and share it with somebody that you think needs to see this. And please consider subscribing to our channel. Thanks so much for watching. We'll see you in the next video, friends. Bye-bye.